name is Amanda Moraguez, and as a medical student, I come across a lot of medical issues and choices that we will all encounter in our lifetime, especially now with the advancements in technology in the medical field, specifically robotic surgery. Robotic surgery is a procedure that consists of the surgeon controlling a machine from another room. Some people think that robotic surgery is better because it is more advanced and steady. However, that is not the case. A surgeon could be just as steady and efficient, but without the worries of not being able to control any complication or issue that may occur. Deciding to go through with surgery is a big decision because it is a very risky procedure and can be very nerve-wracking at times. When you are laying on the operating table, trying to put your nerves aside, the comfort of the doctor telling you that everything will be fine usually makes you calm down a little. You start to trust the doctor's knowledge of what they are doing. However, if the doctor were to step into a separate room and tell you that they would be operating you through a machine, you'd then have to put your trust not only into the doctor, but also the technology of robotic surgery. Using robotic surgery can be very risky, and therefore you should choose to not put your life in the hands of a robot. Also, there are many disadvantages of robotic surgery, such as its precision, there is no tactile feedback, and it is very costly. Precision means precise. When operating on a patient through robotic surgery, all calculations must be precise, and any little change or miscalculation can put a patient in danger. For example, if the machine were to cut too deep into the skin, it could destroy perfectly healthy tissue in the body of a patient. A surgeon would be able to see if they were cutting too deep and be able to stop before any tissue was damaged. The development of robotic surgery is not quite complete either, so not many professionals are trained well enough to handle any breakdown that may occur. This could lead to many complications during the surgery, such as malfunctions in the machine. While performing surgery, the machine could go through a reboot or changing of position to another set arrangement that it is accustomed to. If this were to happen, it could lead to the death of the patient. Another complication to be aware of is when adjusting the robot to a patient, it could mean having to tie it close to the patient, being the result of an infection or increased blood loss. Keep in mind that the robot does not have eyes, so if there was any complication in the way of the surgery, the robot would not be able to see it. It is only doing what its calculations tell it to do. The doctor is too busy controlling the machine, so he or she would not be aware of the situation because they are not the ones performing the surgery. On the other hand, if the surgeon was performing it, they could easily spot any difficulty in the way of the surgery because unlike robotic surgery, surgeons have eyes. Aside from the many risks of robotic surgery, another important disadvantage is that there is no tactile feedback. So, if the patient had certain organs that needed to be protected, they can't give feedback on it because they were not the ones performing the surgery by hand. Furthermore, let's say while making an incision into the patient, a vessel appears to be abnormal. If the surgeon was performing the surgery, then they would have taken note on it and listed it in a medical document of the patient. Nonetheless, using robotic surgery cannot give the feedback that a surgeon could if performing the surgery. Feedback is important in healthcare because it can help improve medical care by noting any positives or anything that help make the surgery easier. Or, if a complication occurred, the surgeon could try and understand why it happened by using the feedback recorded and to prevent that type of complication from happening again. Lastly, not only is robotic surgery dangerous, but is also expensive. Purchasing and maintaining the equipment is estimated to be over $1 million. In addition to the price of purchasing and maintaining the robots, the technology is also being updated continuously with new tools that are also pricey. The staffing procedures are also accumulating to the cost because the surgeries are taking longer because of the need to adjust to each patient and the altering of tools. As the patient, the cost is more expensive because the length of time it takes to perform the surgery. The longer the surgery is, the more anesthesia is needed because of the extended time of operation, which means more expenses. The expenditure of robotic surgery is at least $2,000 more than surgery performed by surgeons. Why pay so much for something that might result in complications and longer surgery performances when you could pay less for a more promising and quicker operation performed by surgeons? In conclusion, robotic surgery has many disadvantages that make the risks not worth it. The operation takes longer, it costs more, and it could lead to more severe complications. Putting trust into the doctor and letting the surgeons perform their jobs manually is less expensive, more efficient, and less time-consuming. Therefore, if you had to choose whether to let a robot operate on you or a surgeon, you should pick the surgeon in a heartbeat. So, before lying down on that operating table, make sure you let your doctor know that you do not want a machine operating on your body. Research your procedure and talk to your doctor, and make the choice that is right for you by not choosing robotic surgery. I hope you enjoyed learning a little bit about robotic surgery and why you should be against it.